what are some good policies that a practice can implement to handle cancellations, no-shows, while still making sure that they're maintaining a positive relationship with their patients?
Yeah, great question. And there are lots of different strategies we've used over the years, and I'll sort of try to throw out different ones. And again, depending on other size of practice and employees and things like that, there are many options that can be helpful. I'd say the first piece is when a patient's coming to see you, you need to have office policies. And within the office policies, you need to include some HIPAA language, and you need to include some consent for treatment language. Over the years, we used to have many different policies for people to sign, like consent to treatment, office policies, payment, a separate no-show policy. But what I found over the years is I think it's easier just to put it all into one document. So within that one document, including everything that's needed, but having special attention to the no-show and cancellation policy is what we try to do. And, for example, we have a 48-hour cancellation policy. We try to make that very clear. And currently in the clinic, the fee for cancellation varies depending on provider level, where for a master's level provider, it's a $100 fee for a no-show or late cancellation. For a PhD level, it's $200, and for a prescriber, it's $300. The reason we have those fees in place is so the business still does lose money because that's lower than other reimbursement rates, but it helps capture money to at least maintain the salaries of the providers. Everything is sort of signed digitally now. So when people are signing it, we have them initial these fields. However, as you know, when you're doing these electronic initial here, sign here, even when they weren't electronic, people are rarely reading what they're signing. They're not always reading, these policies. So if you really want to do the right thing, you need to, at that first session, have your admin or yourself have a conversation about the no-show and cancellation fee and let people see what they've signed. And it feels much better to have that conversation and prep people than they have their first late cancellation and they're like, what do you mean it's $300? It's like, well, here's where you initialed that you agreed to this. And then, well, I don't read that, and et cetera, et cetera. So as we're in the therapy field, having a conversation about that is helpful. We've experimented with doing things like giving people one free late cancellation or no-show for any reason in a year period. We certainly have a emergency excuse. However, we're pretty strict about that. Like, if it's a car accident or something, of course, but we don't let people say they're sick. We require a doctor's note sort of documenting that they're sick, because it unfortunately is too easy to just call in and say you're sick to get out of your no-show fee. So we kind of make it like a school or work policy. Okay, you're sick, that's fine. A lot of companies have, where's your doctor's note if you're going to be sick?
But in this case, it's the school might do that because it's a way of encouraging, good attendance. But in this case, it's really about helping to continue supporting the business and making sure that the business can, afford its own bills.
Correct. And also, wanting to make sure that if people are on a schedule for their treatment, that they are consistent with that schedule also. But this is really, there's some piece of this around care compliance, but it is really more of a business discussion. And I would say what we've alluded to is as our number one strategy for no-shows is calling them if they're not there within 5 minutes and trying to switch it to a telehealth session. And sometimes this is, you can bill a therapy session as long as you're hitting 16 minutes. And if you're a prescriber, you can bill E&M codes based on complexity, even if it's a 5-minute visit. So if you can get the patient on the phone, or even if they're going to not answer the phone, you can leave a message, or if you have texting abilities, hey, if we can do a 20-minute check-in, you can avoid that no-show fee, tends to be a powerful way to engage people who have planned to no-show. So kind of stopping the no-show in its tracks.